Hi, I'm Dr. Greg Hollstrom at the Florida Center for Back and Neck Pain. Frequently I receive questions about dizziness. Sometimes it is a presenting complaint, and sometimes it's a secondary complaint that patients have in conjunction with their neck, middle, and lower back pain, which caused them to come into the office to seek help. The treatment for dizziness will depend on its cause, and the three main causes for dizziness include the cervical spine or the spine, the middle ear, and sometimes it can be caused by irregularity in the beat of the heart. With a good history and physical exam and sometimes some follow-up testing, it is oftentimes possible to determine exactly what the cause is. In dizziness that is produced by the spine because of joint dysfunction, chiropractic manipulation or mobilization or axial decompression are oftentimes very effective. This type of dizziness is the type of dizziness that will present with movement to one side or the other, sometimes with looking back, which persists for as long as you maintain the movement. When this is present, and remainder of the physical exam findings for other forms are not present, it treats relatively well with mobilization and conservative care, which includes manipulation, nerve and muscle stimulation, and sometimes ultrasound, which is high-speed sound waves, designed at reducing the amount of irritation in the surrounding soft tissues involving the spinal joint. Dizziness that comes from the middle ear can come from a variety of sources, and a good history and a physical exam can help determine what that may be. One of the more common causes is something called benign positional vertigo, which occurs when small calcium-like rocks in the middle ear are displaced from the back portion of the canal. When this occurs, they can free float at the bottom of the canal, and when we move, the fluid in that canal, which rotates against little hair cells that allows our brains to sense motion, will continue to spin about. And as they continue to spin about, they will produce the sensation of feeling like we're moving when we're not. If that is the case, there are some very good orthopedic maneuvers which can help determine if that is the cause. If the cause is benign positional vertigo, there is a technique called the Epley procedure, which involves some very simple positioning or repositioning of those rocks to bring them up around the canal and back where they should be. Over the years, I've never had to perform this test more than 3 or 4 times, and sometimes even after just one treatment, dizziness and or spinning or vertigo, some patients have had it for many, many years, is gone. Sometimes it comes back, sometimes it doesn't. If it comes back in the future, it usually responds very well to this repositioning technique. A third cause of dizziness would involve irregularities in the heart. A good physical examination involving sometimes an EKG, sometimes just examination. The heart will help determine where the heart or abnormal beats or rhythms are present. If that is the case, a referral is made to the cardiologist, who will determine the problem, what the problem is, and what is the best way to treat the heart for that particular type of dizziness. Here at the Florida Center for Back and Neck Pain, the forms of cervicogenic dizziness, dizziness from the neck, and benign positional vertigo treat and respond very well with a high level of success. I'm Dr. Gregory Hollstrom here at the Florida Center for Back and Neck Pain in Largo, Florida.